September is Blood Cancer Awareness Month. Every 3 minutes, someone in this country is diagnosed with a blood cancer. There's so much to learn. Right now, joining us, Dr. Jeff Mattis from the Colorado Blood Cancer Institute. To start with, doctor, tell me exactly what are the different kinds of blood cancers and how common are they in our society?
Sure, Jim. So blood cancers are cancers that arise from the blood or bone marrow or what we call lymph node tissue. And so examples of blood cancers would be leukemias, lymphomas, and multiple myeloma, among others. And so individually, they're not terribly common compared to some other cancers, but taken in total, they're pretty darn common, maybe 20 to 25% of all cancers, Jim.
Oh, my gosh, that's a very sizable amount. And one thing, doctor, I know, congratulations, where you were 30 years now of taking on these diseases. And I think I learned that you treated some 5,000 patients there.
Well, that's just 5,000 stem cell or bone marrow transplants over 30 years, Jim. And so many more patients, of course. And so, yeah, we're pretty honored to have been part of our community and be able to provide this service to our patients for these last 30 years.
Doctor, what are some of the signs, some of the symptoms that people might be able to watch out for?
Sure. So some blood cancers are really silent and they're discovered sort of by accident. I call those incidentalomas. Patient goes to their doctor and they get some blood work done or a physical exam and they're discovered to have a blood cancer. But when patients have symptoms, typical symptoms include fatigue, sometimes unintentional weight loss, sometimes growth in lymph node tissue, abnormal bleeding, fevers, or infections. So they can be quite varied.
Doctor, I know I get a physical every year. I'm pretty religious about it. And so I guess that certainly one of the benefits there is the extensive blood work that is done. It's probably a good recommendation for a lot of people.
Well, certainly from the perspective of a hematologist, we like people to get their blood counts checked with some regularity. But a lot of times, though, the blood work doesn't even show evidence of the blood cancer, which is surprising, but sometimes that can happen. So a lot of times, again, folks, they present with symptoms and they're just not feeling well, and then a workup ensues, and then sometimes we find evidence of a blood cancer.
Are the blood cancers, doctor, something, for example, say, oh, my grandmother had it, my dad, would somebody like that be more prone to getting it, the risk factors?
Yeah, some of the blood cancers can be partially hereditary. And so it's important to always, when you're seeing your physician, to tell your physician, hey, my mom had leukemia, or my brother has chronic leukemia or multiple myeloma. That's very important. But most blood cancers occur just by chance, Jim. And when patients ask me, how did I get this blood cancer? Really, the most common explanation for why people get blood cancers is bad luck.
Yeah.
It happens.
And doctor, might somebody 35 years old be as susceptible as a 65-year-old, or do the risks increase as we get older?
For almost every cancer on the planet, Jim, the risk of getting cancer increases as we age. And so blood cancer is relatively uncommon in younger people. One that you can see is called Hodgkin lymphoma in younger people.
Heard of that, yep.
Some of the acute leukemias as well. But most of the blood cancers, chronic leukemia, acute leukemia, multiple myeloma, among others, they increase in incidence as we age.
And we know that there have been tremendous advances in treating other types of cancers, breast, prostate, what have you. Doctor, what types of treatments exist for the blood cancers, and have they improved much in the last 10 or 20 years?
In fact, more often than not, Jim, the blood cancers are where the research is the most cutting edge. A lot of the other cancers that have benefited from research, though that research began with blood cancer research. And so, for example, there's a type of leukemia called CML that 30 years ago, we really only could cure it with a bone marrow transplant, and now we have effective oral medication to treat this cancer. We also have a number of new treatments that can harness the patient's own immune system to learn how to better attack the cancer. That's very exciting. And then with respect to bone marrow transplants or stem cell transplants, the survival rates and the safety of transplants has increased dramatically over the last 30 years due to advances in technology.
Well, doctor, just remarkable work being done by you and your colleagues there. Thank you very much. One more question. How can are there screenings, or might the the hospitals or our healthcare providers have screenings that people can tap into during a year?
Not so much for the blood cancers, Jim. For the screening mostly applies to the cancers that we would consider screening for: colon cancer, prostate cancer, breast cancer, and skin cancers, those kinds of things. But for blood cancers, usually not a lot of routine screening is recommended.
All right. Well, Dr. Mattis, thank you so much, sir, for joining us, and continue just your remarkable work on behalf of the community. We appreciate it.
I really appreciate it, Jim. Thank you very much.
All right, sir. Have a great weekend. And remember, it is Blood Cancer Awareness Month. Coming up in September, we have so many resources for you at our website, cbsdenver.com.